I see a lot of patients with rotator cuff pathology. And that can vary anywhere from tendonitis, which is inflammation of a tendon, which can cause pain and stiffness, all the way to what's called a full thickness tear, where the tendon is torn off the bone. Okay. These can present in different ways. They can certainly be traumatic. So if someone falls and injures their shoulder and is having a hard time lifting or a lot of pain, that certainly should be evaluated. It can also go to chronic pain. So in other words, someone has had mild discomfort that's gotten worse over time with increased weakness, loss of motion, and certainly increased pain. And if mild anti-inflammatories and activity modification and some exercises aren't working, that's another good reason to be evaluated. Okay. In the office, what I'll do is I'll typically do regular x-rays to evaluate bone structure, physical exam to help evaluate an early diagnosis. And then depending on what I find, it could potentially be immediate treatment with something mild like anti-inflammatories, sometimes cortisone shots I can do right in the office if that's appropriate. If I am worried or I want to get a further diagnostic test, I'll typically send someone for an MRI. And that's just a way to see the rest of the anatomy. So that'll show me all the tendons, all the cartilage, all the ligaments, and I can make a very specific diagnosis and then therefore have a very specific treatment plan. Okay. And even still, a lot of times it could potentially be non-surgical. But certainly the other option I have as a surgeon, obviously, is if there is an issue that is not going to heal by itself or that has gotten worse with non-surgical treatment, it is then potentially a surgical issue. I have 20 years of experience in arthroscopic techniques, and so everything we do now is arthroscopic, which is, I guess, considered minimally invasive. Outcomes tend to be excellent. Depending on how bad a rotator cuff tear is, it can be anywhere from a month to 6 weeks recovery if it's fairly minor, to 4 to 6 months if it's a large tear that requires a reconstruction with a large repair. But they tend to have excellent outcomes, and I would say, the lion's share of my patients get full function, sometimes even better than before. Okay, so with rotator cuff tears, it's very worthwhile that if it's still bothersome, it's worth getting evaluated. Going into it, if a shoulder is fairly healthy, not badly arthritic or anything, absolutely should expect full range of motion. Now sometimes I'll deal with someone who's got some pre-existing arthritic problems, and then they develop rotator cuff tears. Those I can typically get back to baseline with no pain and maybe slight loss of motion that they had before. But if someone has an otherwise normal shoulder, they should expect to get back to full range of motion. Physical therapy is very, very important. Okay, and I use that typically even with non-surgical outcomes. So if someone's got tendonitis or inflammation or stiffness, I typically use a physical therapy specialist, shoulder specialist, to work with them. It's absolutely required after surgery for typically at least 4 to 6 weeks working with a physical therapist to safely get range of motion back first and then strength. And that's a very important role of physical therapy.